So continuing on the series on DPDP Act for various industries, let's talk about healthcare today, where there is a lot of personal data and a lot of sensitive personal data. Welcome to my YouTube channel where you regularly see new content on data privacy, and as I said, let's talk about DPDP Act in healthcare today. So is there any specific important data, sensitive important data available in healthcare? Yes, a lot. What? Everything. Why everything? Because except for just the name and the phone number and the address, everything is related to the health of the individual, and breach could be very, very impactful, far beyond just a financial one. So, what kind of data exists in healthcare? The medical history. Remember complete history and record, and beware of doctors who write wrong uh, ailments to you, which happened recently with my brother, where one of the best hospitals in Mumbai ended up creating a discharge summary with wrong ailments. Be very careful when they create your medical record and medical history. They also have your diagnostics and treatment records, prescriptions that were assigned to you, lab reports, insurance documents, KYC documents, insurance documents. Once they are out, they have a lot of sensitive information in them as an individual document itself, because they would have your financial information also. Financial information would also be available with the hospital, because hospital or healthcare like clinic or lab, wherever you go, because they also charge you, right? And everywhere these days you don't end up paying just by cash. A lot of people now pay by UPI, and at least the UPI ID goes to the recipient. Your emergency contact details, data of minors, if at all they are there. So a lot of data that exists with healthcare in different forms. For some basic patients, there would be only some lab reports. For some advanced payments, there could be longer diagnostic treatment reports, long medical history, and they are all sensitive. They are all sensitive. You might have had a disease that is cured, but if the record is still there and gets breached, it can impact you. Regardless, to mention the biometric data for logins, etc. Why healthcare is a high risk thing? Because it is not just inconvenience, right? It is not just saying that I'll get my credit card blocked. In any case, it didn't have funds, so no one can misuse it. It is not just financial impact. It had funds, only 2 lakh rupees, so the maximum fraud can be only 2 lakh rupees. Healthcare information is far beyond just inconvenience or just financial impact. There's a lot more than that. What is it? Emotional harm. Like I am feeling right now. My brother didn't have those ailments. That hospital mentioned them in the discharge slip. And the moment I went and put that discharge papers on the other hospital, that other hospital said, "Oh my God, he had so many diseases." Right? I clarified, and that hospital we have been there earlier, so the things got sorted out. But it still hits me till now. Why has someone written wrong ailments to my brother, who eventually succumbed to his ailments? So how can a doctor in his discharge summary can put wrong ailments? Now imagine that discharge summary getting leaked outside in the environment and saying he had these ailments. It would hit him also emotionally if he was around now. Possible discrimination. Luckily, his diseases were not worth the discrimination, but it really depends. And we are talking of wrong record right now. What about people who had a disease? Probability of discrimination at that point in time, probability of isolation at that point in time, but now that disease is over. And therefore, they don't need to publicly say that once upon a time I had this disease, but if their information goes out of the healthcare institution, it could be risky. Insurance issues. Again, wrong ailment, insurance can get you into problems, and I'm fighting it out right now. Misuse of your personal integrity, right? You told us a lie, your doctor says you had a different disease. Right? Key compliance requirements. Mandatory explicit consent. Now, this is not treatment consent that medical things have been there for ages altogether. This is more of consent about utilization of your personal information. Purpose based access. Data should be accessed only by people who are allowed to or required to access it. Special rules for minors. Their data is very critical and has to have much more longer life than a 50-60-year-old person. Very strict retention controls. Vendor governance, because you are sharing a lot of information with third parties. Even if the lab guy sits in your hospital premise, he is outsourced. Audit logs and access monitoring of all this information, and very importantly, the breach response plan. Does the hospital have a proper breach response plan or not? These are very, very important factors. So you need to have secure digital and physical records, and you can always debate that DPDP does not take care of physical records, but well, records are records, right? And the chances of getting records in scanned format in a hospital, very high. DPDP Act compliance touches every part of the hospital and the individual. Right from registration, you get your PI as shared. Consulting doctors get some more information about your ailments. His diagnosis has more information about you. The prescription, the medical tablets you are going to eat, they talk about you. The billing system talks about your financial information. The record management has to be very, very clear and safe and secure. Follow-ups also are done at the hospital, so you need to be very, very careful with all your information. So what systems need upgrade? Patient onboarding. You have consent forms and privacy notice banners over there. You need to have them if you don't have them. IT systems, the EHRs, the EMRs, the teleconsulting apps, cloud storage. I was told about this a couple of days back that at 3:30 the doctors are going to take a teleconsulting advice. So doctors, senior doctors of one hospital, another, and they have a consortium, and they sit on Thursday 3:30 to discuss individual cases. Are they under strict privacy compliance? HR, common thing for any business, and we're going to have a module on HR itself. Vendors, billing software, labs, pharmacy, cloud backups, and security. Is the data encrypted? What are the access logs? What is your breach response system? Retention and deletion? Well, you can delete them as and when you want. No, healthcare cannot. HIPAA wants the data of patient to be there for at least 10 years after the death of the patient. So healthcare cannot. So ideally they should follow DPDP compliance, but the retention part of that is far larger in other compliances than in DPDP. So they need to follow the other. So DPDP says whatever I am saying is good, but if there's someone else who wants you to retain that record for a longer period, follow them. Have more compliances to follow. Data retention has to be long term, and the focus has to be on the storage where it is being retained. One important part, it has to be encrypted and access control. And because it has to be there for long period, 10 years, 15 years, 20 years for different patients, it should not be that the storage becomes a part of the shadow IT. It's lying somewhere and it's not under active management of anyone in the organization. Secure retention and secure deletion of the data is another very key important aspect. So you should start. You should first of all create a roadmap. Have a plan. What are you wanting to do? You cannot do everything in one day or one night. So you need to be very, very meticulous about it. Think for first 30 days to at least build up a privacy notice, the flow of consents, and awareness of your staff members. Spend more time in doing data mapping, vendor reviews, and access controls. And maybe 90 days, logs, retention flows, breach response, and compliance reviews. Now, this is a wish list, suggested roadmap. Hospitals can do it faster because there are a lot of things that they already do, and a lot of highly secure IT is already deployed in most large enterprise hospitals. So that's about a small introduction on how DPDP Act would affect healthcare. I hope you like the content of the video. We are going to talk about BFSI tomorrow, and as mentioned earlier, next 10 days we are going to talk only about different industries with respect to DPDP Act. So stay tuned, subscribe to my channel, and share your feedback and queries in the comment section. Thank you.